na inazidi kuenda kwa koo na inakuziba kupumua, kukula, kuongea.
Naam.
Haya yote ukishagundua umefika hali hiyo ni wakati wa kwenda kwa hospitali.
Naam, Dr. Kate, most of us think that mambo ya meno ni kusugua tu, inaishia hapo. Unaweza tueleza kidogo ni nini unatarajia mtu mzima kufanya when it comes to dental care? Huyu hayuko mgonjwa, just routine dental care. What does it involve?
So for routine dental care, number one, you start at home.
Naam.
Sa nyumbani lazima usugue meno vizuri asubuhi na jioni. And then also we need for you to understand dental disease, you need to know kuna ugonjwa mbili za meno. Kuna gum disease ambayo ni ugonjwa ya gums, and then also dental caries whereby it's the tooth hard tissues that are affected. So for the gum disease, there are two types. There is gingivitis and then also chronic periodontitis. Gingivitis is just a mild form of the gum disease. So at this stage, you can just advise the patient, to the general public, to brush their teeth properly in the morning and in the evening. And then also we need to see a dentist at least once a year. And then once it comes to chronic periodontitis, now this is a bit more advanced gum disease. It's when you need to go to the dental clinic where they'll do deep cleaning, which is also called scaling. And then also you will need to have some antibiotic therapy, and at this point you'll need to see a gum specialist once or twice a day. So for the diseases of the dental hard tissue, which ni kama na meno yenyewe sasa, you need to understand the biology of the tooth. A tooth has 3 layers. The outermost is called enamel. Then the next layer is called dentin. Then the innermost is called the pulp. So pulp is part of the tooth that has nerves. So the pulp, sometimes it can give the nerve endings to the dentin. So if the cavity is just on enamel, you won't feel pain because enamel has no nerves. But when it goes to dentin, you start getting some bit of sensitivity. And then when it goes to the pulp, you get severe pain. So at the point that the cavity is only at enamel, you can just have either a filling done, or sometimes just on preventive, especially for children, we can do pits and fissure sealants, and sometimes we can also do fluoride therapy. Yes, so that's it on the preventive dentistry. Yes.
Sasa rejelea pale unasema kupiga mswaki properly. Properly inamaanisha nini? For how long? Vipi? Kwa sababu unajua tunasema tupiga mswaki. Inamaanisha nini haswa?
So number one, you need unahitaji kuwa na mswaki mzuri. Na si lazima hii mswaki ya kununua kwa duka. Kitambo zamani kabla tuja Nairobi, tulitumia ile mswaki ya miti. And that was effective because what matters is how much and how long you brush your teeth. Then when brushing, usisugue tu hapa mbele peke yake wakati watu wanaona, mali watu wanaona. You have to brush all the surfaces, and especially at the back of your teeth where most cavities start. Then the other thing about brushing ni ati kwamba usibrush asubuhi kabla ya breakfast. Watu wengi sana, most of the people, we only brush our teeth for social reasons, so that people not to feel that you have a bad breath. So we need to brush our teeth in the morning, but after breakfast, because at least during the day you won't have a plaque or food accumulation on the teeth. And then in the evening, it's the most important time to brush your teeth, because kumbuka, when you're sleeping, the saliva flow in the mouth is reduced. So if the saliva is reduced, there'll be so much bacteria accumulation on the teeth. So it's most important. In the morning, I usually tell my patients, in the morning we brush for social reasons, so that during the day you're not smelling bad. But in the evening, it's the most important time to brush your teeth, because remember, at this time you're done with your day, and you have a lot of time. So you can spend between 3 to 5 minutes brushing your teeth properly and ensuring, especially at the back of your teeth, you've brushed well. And it's important also to use a fluoridated toothpaste. And sometimes, especially if you have an infection or if you have gum disease or if you have bleeding gums, you can combine that with a mouthwash. Yes.